Hi everyone. Have you ever woken up from a sleep and had a lot of pain in your jawline, had a lot of soreness in your teeth, and just had throbbing and aching and feverish and chills and all the other miserable things that come with it? And this is what I'm talking about is an impacted wisdom tooth. Now, I have been experiencing this for the past 2 or 3 days, and I've had to do a lot of research on the topic. It is not what I originally chose for my informative speech, but it's definitely something that has become near and dear to my heart over the past few days. Um, okay, so it's usually your wisdom teeth. They usually erupt in between the ages of 17 and 21 years of age. Usually have two on the top, and two on the bottom. Now, these can become impacted when they do not have enough space to grow. And so they can either grow back into your jawline, they can grow and crowd other teeth, they can do all sorts of damage to the teeth that are around it. Now, not everyone gets these, and sometimes they're asymptomatic. So a lot of patients, they have impacted teeth and they experience no pain whatsoever. Now, unfortunately for me, I've had pain off and on since I was probably 20 years old when they first came in. And I've ignored it and ignored it. And now at age 38, after the dentist telling me multiple times to go and have it taken care of, this is what I get to deal with now. So finally going to take care of the situation. But so your wisdom teeth, they are very hard to clean because they're so far back, and when they become impacted, then it makes them even more difficult to clean and to take care of. And not saying that that's definitely the only issue, but that allows for more bacteria to get into the area and can cause a lot more issues than the rest of your teeth will. They can result in pain, damage to other teeth, and other dental problems. Hard to clean, but they don't always cause problems. Their symptoms include red, swollen gums, jaw pain, tender areas, bad breath, unpleasant taste, and difficulty opening your mouth. Now, it can also include pain that goes all the way around your jawline, as I have experienced. Um, so they grow in at an angle. Now you need to schedule an appointment with the dentist. The only problem is that it's hard to get into one. It's not necessarily an emergency situation, but it is something that you do need to have taken care of. So in the meantime, they do sell several products at stores. They have this lovely Crest sensitive toothpaste that when you brush 2 to 3 times a day, it definitely helps to numb that area, and it puts a nice little coating on there. It helps to soothe some nerves. They have this is triple medicated ointment to put on your teeth. So you can apply this several times a day. It says up to 4 times a day. And so you put it just inside those cavities or all along the jawline here on the inside of your mouth, of course. Not on the outside, but on the inside. One good tip is this. This is a cold pack. It's actually from my child's lunchbox, but you can use any cold pack that you want to. Just put it in the freezer and be careful not to apply it directly to your skin, or else you can get some, it can cause some tissue damage on the outside of your skin. So what you need to do is you need to take it and just wrap it in a cloth. You can wrap it in even a little bit of a damp cloth. Put it on your face and hold it on there. Hold it on the affected area. I would not do this for more than 20 minutes at a time. Take it off just because you do not want to cause any more damage to that area. If you're experiencing any fever, you can take some ibuprofen or acetaminophen, or just whatever that your doctor would normally recommend for the pain. So whatever that you can normally take for a fever or for any other painful issues, then that's something that you would need that you could take now. Just make sure you follow the instructions, and I know that it's so tempting, but make sure that you do not overdose yourself in that. Make sure you go exactly like the instructions say. One more product that I felt has been wonderful is this. It's your Orajel. It numbs out. It says it's non-numbing, but it does have a little bit of a numbing factor. It does contain a couple medications. You can swish 10 milliliters. It's about a half a capful over about a minute, 4 times a day, and it definitely helps until you can get in to see the dentist. Now, a lot of times when you go to the dentist, what he's going to do is he's going to take a look at your mouth. He's going to do some x-rays, some examination, and to see if it's something that needs to be taken out. They said that a lot of the treatment that I've read online is removal, and So that's something that you will get to look forward to when you go to the dentist, possibly. But they will do some x-rays and troubleshoot and see what they need to do to take care of the problem. And hopefully you will not be like me and just let it go for years and years and years, and that you will actually take care of the problem when the dentist originally tells you to, instead of ignoring his plan of care. Sometimes, as a nurse, I am the absolute worst patient possible. But this is about impacted wisdom teeth, and I apologize for my appearance, but that is exactly what I've been dealing with for the past couple days, and I will get in to see the dentist very soon. So there's some tips, some advice on what to do and how to treat it, and good luck, and hurry up and make it to the dentist.